I'm about to tell you something that could quietly determine how long you live. And it's been written on every blood pressure reading you've ever had. Two numbers. One stacked over the other. You've seen them for years. Your doctor mentions them in passing. Maybe you even track them at home. But here's the truth: most people over 60 are never clearly told. One of those numbers becomes far more dangerous as you age. And it's probably not the one you've been worrying about. I'm Dr. Christina Serrati. For over 2 decades, I've worked with patients facing heart failure, stroke recovery, and advanced vascular disease. I've sat beside families after devastating events that could have been prevented. And over again, I've seen the same mistake. Patients focused on the wrong number. They celebrated the good reading, while the dangerous one kept climbing. What I'm about to explain isn't theory. It's based on decades of large-scale cardiovascular research involving hundreds of thousands of adults. By the end of this video, you will clearly understand which blood pressure number becomes the real threat after 60, why aging changes the rules, and what you must do starting now to protect your heart and brain. Let's start simple. When that cuff tightens around your arm, it's measuring the force of blood pushing against your artery walls. But your heart doesn't pump in a steady stream. It beats in pulses. That's why you get two numbers. The top number, called systolic pressure, measures the peak force when your heart contracts and pushes blood forward. The bottom number, diastolic pressure, measures the pressure when your heart relaxes between beats. Think of it like waves in the ocean. The systolic number is the crash of the wave. The diastolic number is the quiet moment before the next one rises. For decades, both numbers were treated as equally dangerous. If either was elevated, treatment was recommended. But long-term data began revealing something critical. After age 60, the balance shifts. The upper number, systolic pressure, becomes a far stronger predictor of stroke, heart attack, heart failure, kidney damage, and even cognitive decline. In fact, large population studies found that in older adults, elevated systolic pressure predicts cardiovascular events 2 to 3 times more powerfully than elevated diastolic pressure. Let that sink in. 2 to 3 times. And yet many people over 60 still focus mainly on the bottom number. Why? Because no one explained how aging changes your arteries. And that's exactly what I'm going to show you next. In part 2, I'll explain why arteries stiffen with age, and why that makes your top number quietly rise even when your bottom number looks normal. Because once you understand that mechanism, you will never look at your blood pressure reading the same way again. Now I need you to understand something that most people are never shown on a diagram. Your arteries are not rigid pipes. When you're young, they behave more like flexible rubber tubing. Every time your heart beats, they stretch slightly to absorb the force, then gently recoil to help push blood forward. That elasticity is protective. It cushions your organs from pressure spikes. It smooths out circulation. It keeps the systolic number, that top number, relatively controlled. But aging changes the architecture of your arteries. Over time, the elastic fibers inside artery walls begin to weaken. They slowly get replaced with stiffer collagen. Microscopic calcium deposits can build up. Low-grade inflammation accelerates the process. Plaque may begin forming along the lining. Gradually, arteries lose their stretch. They become more like stiff garden hoses than flexible tubing. And this is where everything shifts. When your heart contracts and pushes blood into stiff arteries, those arteries cannot expand properly to absorb the surge. So the pressure has nowhere to go. The systolic number rises. But here's the part that confuses people. Because stiff arteries don't recoil efficiently either, the resting pressure between beats, the diastolic number, often stays the same or even drops. This creates a pattern called isolated systolic hypertension. High top number. Normal or low bottom number. And it becomes extremely common after age 60. Many patients see a reading like 160/72 and feel reassured because the 72 looks good. But physiologically, that pattern often signals significant arterial stiffness. And stiffness is not benign. It means each heartbeat is delivering a sharper, more forceful impact to delicate blood vessels in your brain, kidneys, eyes, and heart. Imagine repeatedly striking a fragile surface with small but relentless blows. One strike won't break it. But thousands per day, for years? Damage accumulates. This is why elevated systolic pressure becomes so dangerous later in life. It's not just a number. It's a reflection of structural change in your vascular system. And every spike in that top number increases shear stress on artery walls, accelerating plaque instability and microvascular injury. Over time, this raises the risk of stroke, heart enlargement, a kidney decline, and memory impairment, vascular dementia. And here's the critical truth: you cannot feel arterial stiffness happening. There are no warning symptoms, no early pain, no gentle alert from your body. The first symptom is often the catastrophic event. In Part 3, I'm going to explain exactly how elevated systolic pressure damages your brain and why many cases of so-called Alzheimer's are actually vascular injury in disguise. And this is something every adult over 60 must understand. Let me tell you something that unsettles many of my patients. You can have serious brain damage developing and feel completely normal. No headache, no dizziness, no warning sign. Elevated systolic blood pressure does not announce itself loudly. Instead, it works quietly, almost invisibly, inside the smallest blood vessels of your brain. Your brain is fed by a network of extremely delicate arteries. These vessels are thin, intricate, and highly sensitive to pressure changes. When systolic pressure repeatedly spikes, 150, 160, 170, that force travels directly into those tiny vessels. At first, the damage is microscopic. Small tears in the vessel lining, tiny areas of inflammation, subtle narrowing. Your body attempts to repair these injuries. But the repair process makes the vessels thicker and stiffer over time. Blood flow becomes less efficient. Eventually, two dangerous things can happen. First, a vessel may rupture under chronic pressure stress. That leads to a hemorrhagic stroke, bleeding into the brain. Second, the vessel may narrow or become blocked. That causes an ischemic stroke, a clot cutting off oxygen to brain tissue. But here's what's even more concerning. Long before a major stroke occurs, elevated systolic pressure can cause what we call silent microinfarcts. These are tiny strokes. So small you don't feel them. No dramatic collapse. No ambulance ride. No obvious paralysis. But small clusters of brain cells die. And this doesn't happen once. It can happen hundreds of times over years. Gradually, this leads to slower thinking, word-finding difficulty, balance problems, personality changes, and memory decline. Many people are told they're developing Alzheimer's disease. But in a significant number of cases, what's actually happening is vascular dementia, cognitive decline caused by years of uncontrolled systolic hypertension. The tragedy? It was preventable. Large clinical trials have shown that controlling systolic blood pressure significantly reduces the risk of stroke and cognitive impairment. When systolic pressure is brought under control, stroke risk drops dramatically, in some studies by 30 to 40%. That is not a small effect. That is life-changing. And yet, so many adults over 60 focus on the bottom number, relieved when it reads 70 or 75, while the top number silently climbs. Your brain does not care if your diastolic looks pretty. It responds to pressure spikes. In Part 4, I'm going to explain how elevated systolic pressure reshapes your heart itself, and how years of working harder can quietly lead to heart failure. Because protecting your brain is only half the story. Now let's talk about the organ that's generating that pressure in the first place. Your heart. Most people think heart attacks are the primary danger of high blood pressure. But after 60, one of the most common outcomes of uncontrolled systolic hypertension isn't a sudden heart attack. It's heart failure. And it develops slowly. Here's what happens. When your systolic pressure is elevated, 150, 160, sometimes higher, your heart must push against that resistance every single beat. Imagine trying to blow air into a balloon that's already tightly inflated. That's what your heart is doing against stiff, high-pressure arteries. To compensate, the heart muscle thickens. Specifically, the left ventricle, the main pumping chamber, becomes enlarged and muscular. This condition is called left ventricular hypertrophy. At first, this seems helpful. A stronger muscle can generate more force. But over time, thickened heart muscle becomes stiff. And stiffness changes everything. A stiff heart doesn't relax properly between beats. It cannot fill efficiently with blood. And if it can't fill well, it can't pump well. This leads to a type of heart failure called diastolic heart failure, which is especially common in adults over 60. Many patients describe it this way. I get short of breath walking uphill. I can't lie flat comfortably at night. My legs are swelling more than they used to. But here's the part that surprises people. Their coronary arteries may not even be severely blocked. Their issue isn't a sudden artery clot. It's years of the heart working overtime against elevated systolic pressure. Every beat. For decades. Eventually, the muscle can't keep up. And once heart failure develops, it's not easily reversed. We can manage it. We can slow progression. But restoring full normal heart function becomes difficult. Large cardiovascular studies consistently show that controlling systolic blood pressure reduces the risk of heart failure dramatically. Not slightly. Dramatically. Because when you reduce that top number, you reduce the workload on your heart every minute of every day. Think about it. Your heart beats about 100,000 times per day. That's over 36 million beats per year. If each beat is pushing against excessive pressure, the cumulative strain is enormous. Lower the systolic pressure by even 15 points. And you've reduced strain on millions of heartbeats annually. That's not small. That's protective. In part 5, I'm going to explain something many people never connect to blood pressure at all: your kidneys. And why uncontrolled systolic pressure can quietly push someone toward dialysis, even if they feel perfectly fine today. Most people never connect blood pressure to kidney failure. They think of strokes. They think of heart attacks. But your kidneys are actually one of the first organs quietly damaged by elevated systolic pressure. And the damage can progress for years without symptoms. Let me explain why. Inside each of your kidneys are about 1 million microscopic filtering units called nephrons. Each nephron contains tiny clusters of blood vessels, extremely delicate capillaries, designed to filter waste from your bloodstream. These vessels are thin, fragile, highly sensitive to pressure. When systolic blood pressure remains elevated, that force is transmitted directly into these microscopic filters. Imagine running high-pressure water continuously through a fine mesh screen. At first, it holds. But over time, the mesh weakens. Small tears form. Scarring develops. Filtering efficiency declines. That's exactly what happens inside your kidneys. The earliest stages of kidney damage don't cause pain. You won't feel it happening. There's no discomfort. No warning sign. But slowly, your kidneys lose their ability to filter waste and regulate fluid balance properly. And here's where the cycle becomes dangerous. Your kidneys play a major role in regulating blood pressure. When they're damaged, they lose that ability. Which means blood pressure rises further. Higher pressure causes more kidney damage. More damage raises blood pressure even more. It becomes a self-perpetuating cycle. Eventually, kidney function can decline to the point where dialysis becomes necessary. And here's what's especially important for adults over 60. Age-related arterial stiffness combined with uncontrolled systolic hypertension dramatically increases the risk of chronic kidney disease. Even mild elevations, systolic readings consistently above 140, significantly increase long-term kidney risk. Studies show that aggressive systolic control slows kidney decline and reduces the progression toward dialysis. And this is not just about avoiding dialysis. Kidney dysfunction also increases the risk of heart failure, stroke, dangerous electrolyte imbalances, cognitive impairment. Everything is interconnected. When systolic pressure remains elevated for years, the damage spreads quietly across multiple organ systems at once. Brain, heart, kidneys, all without obvious early symptoms. This is why I emphasize over and over again, feeling fine does not mean you are safe. In part 6, I'm going to address something that confuses many people. What happens when your diastolic number is low, sometimes very low, while your systolic number is high? Because that pattern creates its own unique risks, and many people misunderstand what it means. Now we need to talk about something that confuses many people over 60. You check your blood pressure. It reads 162/58. Your immediate reaction? Well, at least my bottom number is low. But this pattern, high systolic with low diastolic, is not automatically reassuring. In fact, it can signal advanced arterial stiffness. Let me explain. The difference between your systolic and diastolic numbers is called pulse pressure. So if your reading is 160/60, your pulse pressure is 100. That's wide. In younger adults, pulse pressure is usually around 40. As arteries stiffen with age, that gap widens. The top number rises because arteries can't expand. The bottom number drops because stiff arteries don't recoil effectively between beats. This wide pulse pressure tells us something important: your vascular system has lost elasticity. And that alone increases cardiovascular risk. But here's where it gets more nuanced. Your coronary arteries, the vessels that supply blood to your heart muscle, fill primarily during the resting phase between beats. That means they rely heavily on diastolic pressure. If diastolic pressure falls too low, especially below 60, the heart muscle may not receive optimal blood flow. This can lead to chest discomfort, shortness of breath, fatigue with exertion even in the absence of a major artery blockage. It's called supply-demand mismatch. The heart needs oxygen, but the resting pressure isn't high enough to fully deliver it. So what does this mean for you? It means balance matters. We don't want sky-high systolic pressure. But we also don't want diastolic pressure crashing too low, especially in frail individuals or those with known coronary disease. This is why blood pressure treatment in older adults must be individualized. It's not about aggressively dropping numbers overnight. It's about gradually reducing systolic pressure while monitoring symptoms and overall stability. Large clinical trials have shown that lowering systolic pressure in older adults reduces stroke and heart failure risk significantly. But physicians must be careful not to overtreat in a way that causes dizziness, falls, or symptomatic low diastolic pressure. That's why monitoring matters. Home readings, symptom awareness, regular follow-up. The goal is not perfection. The goal is protection. In Part 7, I'm going to walk you through exactly what the current medical guidelines recommend for adults over 60, including target ranges and when treatment becomes essential. Because knowing your personal target can change how you approach your next doctor visit. Now let's make this practical. You understand that systolic pressure becomes more dangerous after 60. But what number should you actually aim for? Here's what modern cardiovascular guidelines recommend. According to major heart associations, blood pressure is now considered elevated once it reaches 130/80. That means if your systolic number is 130 or higher, even if your diastolic looks normal, it qualifies as hypertension. For adults over 65 who are generally healthy and active, most guidelines recommend targeting a systolic pressure below 130. Not 150. Not, whatever feels fine. Below 130. Why? Because large randomized trials showed that bringing systolic pressure into this range significantly reduces stroke risk, a heart failure risk, a cardiovascular death, a overall mortality. In one major trial involving older adults, intensive systolic control reduced cardiovascular events dramatically compared to more relaxed targets. But, and this is important, treatment must be individualized. If someone is very frail, over 80, prone to falls, or managing multiple complex illnesses, slightly higher targets may be safer. Medicine is not one size fits all. However, here's the mistake I still see too often. A 68-year-old otherwise healthy adult walks into a clinic with a systolic pressure of 158. The diastolic is 72. And the response is, well, your bottom number looks good. That approach is outdated. An untreated systolic reading in the 150s significantly increases stroke risk over time. Even readings in the 140s, if persistent, carry measurable long-term danger. The key word is persistent. One high reading doesn't define you. But repeated elevated systolic numbers should never be ignored. This is why home monitoring becomes essential. Office readings can be misleading. Some people have white coat hypertension, where anxiety temporarily raises numbers in a clinic. Others have masked hypertension, where office readings look normal, but home readings are consistently high. Masked hypertension is especially dangerous because it often goes untreated. If you are over 60, I strongly recommend owning a validated home blood pressure monitor, checking your pressure at different times of day, recording readings consistently. Bring those records to your physician. Data changes conversations. In Part 8, I'm going to walk you through the exact strategy for lowering systolic pressure safely, including lifestyle interventions that can reduce it naturally, and when medication becomes necessary. Because knowing the target is step 1. Taking action is step 2. Now we move from awareness to action. Because knowing your systolic number is elevated means nothing if you don't lower it. And the good news is this. Systolic pressure is highly responsive to change, especially when you approach it strategically. Let's start with the foundation, lifestyle. First, sodium reduction. Most adults consume far more sodium than they realize. Processed foods, canned goods, restaurant meals, they're loaded with it. Excess sodium increases fluid retention, which increases vascular pressure. For many adults over 60, reducing sodium intake to around 1,500 to 2,000 milligrams per day can lower systolic pressure by 5 to 10 points. That alone can shift you out of the danger zone. Second, weight management. Even modest weight loss has measurable impact. For roughly every 2 pounds lost, systolic pressure can drop about 1 point. Lose 10 pounds? You may reduce systolic pressure by close to 5 points. That's powerful. Third, consistent aerobic activity. Brisk walking, swimming, cycling, low-impact cardio. 30 minutes most days of the week improves vascular flexibility and reduces arterial stiffness over time. Exercise isn't just burning calories. It literally improves how your arteries respond to pressure waves. Fourth, alcohol moderation. More than moderate intake can elevate systolic pressure significantly. Limiting alcohol often leads to noticeable improvements. Fifth, stress regulation. Chronic stress elevates cortisol and adrenaline, hormones that tighten blood vessels and raise blood pressure. Simple breathing exercises, meditation, even daily quiet time can lower sympathetic nervous system overactivation. But here's the reality many people need to hear: for systolic readings consistently above 140, especially above 150, lifestyle changes alone are often not enough. And this is where medication enters the picture. Blood pressure medication is not a personal failure. It's a protective tool. Modern medications are well studied and highly effective. Many older adults require 2 or even 3 medications to adequately control systolic pressure. That's normal. What matters most is consistency. Skipping doses causes fluctuations, and fluctuating pressure can be more harmful than steady, controlled pressure. If side effects occur, adjustments can be made. There are multiple classes of medications, and almost always an alternative exists. The key is partnership with your physician. Monitor at home. Track patterns. Communicate clearly. In Part 9, I'm going to bring everything together and explain why ignoring this one number has led to preventable strokes, heart failure, and dementia in thousands of adults. And what you must commit to starting today. Let's bring this back to something simple. Every single day, your heart beats around 100,000 times. Every beat sends a pressure wave through your arteries. If your systolic pressure is elevated, that wave is stronger than it should be. Not once. Not occasionally. But thousands of times a day. For years. That accumulated force shapes your future. It determines whether your arteries stay stable or become fragile. Whether your brain stays sharp or slowly declines. Whether your heart remains strong or thickens and stiffens. Whether your kidneys quietly maintain balance or gradually fail. And here's what makes this so important: you often won't feel any of it happening. High systolic blood pressure is silent. It doesn't cause pain. It doesn't create early warning sirens. It doesn't politely ask for your attention. The first sign can be catastrophic. A stroke. A heart failure diagnosis. A sudden hospitalization. Memory loss that doesn't reverse. I have seen patients who were active, independent, vibrant, and within months, their lives changed permanently because their systolic pressure had been ignored for years. Not because they didn't care, but because no one clearly told them which number truly mattered after 60. Now you know. After 60, systolic pressure becomes the strongest predictor of cardiovascular risk. Not the bottom number. The top number. If it's consistently above 130, it deserves attention. If it's in the 140s or 150s, it requires action. This doesn't mean panic. It means partnership. Check your blood pressure regularly. Track it. Bring real data to your appointments. Implement the lifestyle foundations: lower sodium. Move daily. Maintain healthy weight. Manage stress. And if medication is prescribed, take it consistently, not reactively. This is not about chasing perfect numbers. It's about reducing cumulative strain on your organs over time. Even lowering systolic pressure by 10 to 15 points significantly reduces stroke and heart failure risk. That reduction compounds over years. Your heart has been beating faithfully for decades. Billions of contractions. It deserves protection. Your brain deserves stable circulation. Your kidneys deserve steady flow. And you deserve independence for as long as possible. So here's my question to you: when you check your blood pressure next time, which number will you focus on? Because now, you understand the one that matters most. And understanding is powerful. But action is what changes outcomes.